Good evening, everyone. I'm Sayukta from Vistas Media, your host for today on Here All Issues Resolved YouTube channel. We go through a lot of looks beautiful related issues as we grow up, but little do we realize that it's our hair that's our crowning glory. Our hair symbolizes health and personality. Gorgeous and healthy hair is an instant confidence boost. To guide us on how to take care of our crowning glory, that is our hair, we have with us an expert dermatologist, Dr. Shilpa Bhat, live from Bangalore, Karnataka. Dr. Shilpa is a renowned consultant dermatologist. Presently, she is the medical director and chief consultant at Subodha Skin and Cosmetic Clinic Private Limited, Bangalore, which has US FDA approved lasers. It has the credit of being the only all women skin care hospital in South Bangalore. Dr. Shilpa Bhat is a member of IADVL, Cosmetic Society of India, and Association of Cutaneous Surgeons of India. Dr. Shilpa Bhat has received a number of awards at presentations in national and international conferences and has a few publications to her credit, including in peer-reviewed journals. She has also co-authored a few chapters in different textbooks as well. She has been practicing both clinical and cosmetic dermatology for more than a decade, and the response from her patients is overwhelming. A very warm welcome to you, Dr. Shilpa Bhat. It's a pleasure to have you with us.
Thank you so much, Sayukta, for the kind introduction.
And as today we are going to talk about hair, normally because hair is a big thing for us, big concern for us, and we normally do shed hairs every day. But the question is with hair loss, what's normal and when to be concerned? So we would like to begin from there.
All right. See, we all shed hairs just like any other animals, but we shed limited number of hairs every day. So about 100 to 150 per day is normal, but generally most of us shed between 50 to 70 hairs per day. So it's like, you have about 1 to 1.5 lakh hair in our scalp, out of which 0.1% sheds every day, but it regrows. So generally the volume is maintained. So when there is a problem, suppose a lot of reasons behind it, so we shed excessive number of hair, that is when it becomes concern. Or if the hair shedding is normal, but the regrowth is not happening, and you start seeing bald patches and the scalp becomes thinner and the volume goes down, that's when the concern arises. So this topic is very apt because the modern day hair care has changed a lot. So we do a lot of things with our hair, including a lot of parlor procedures. And the current scenario in hair care is a very apt topic because there's a lot of changes that has happened, and the good old grandma things don't work anymore because the hair care also has changed.
Yeah, you're absolutely right when you are saying that, a lot of the modern time, adaptations that we have made. We are blow drying our hairs regularly, ironing our hairs regularly, plus there are so many chemical-based treatments, salon-based treatments, I should say, that we are doing, and no one is having those virgin hairs anymore. And thus the nani, dadi, or granny's nuskha is not working that much. So we would like to understand, doctor, what are the general causes of hair loss? Whenever something is happening which is not normal, more hairs are shedding, and or as you said, regrowth is not happening. What are the general causes?
So the general causes can be divided into acute and chronic causes. The acute causes like in a few months or a few weeks time you've been shedding more hair. That is called acute causes. Chronic means you've been shedding hair for years together. So this is how we broadly divide it into. Under acute causes, like, commonest reason that we see is of late it is COVID, post-COVID hair loss. And any other illness like a fever or a major surgery or any kind of a mental stress, all this can lead to acute hair loss. Or even medicines for that matter. Certain medications can lead to hair loss. Apart from this, there are some chronic reasons for hair loss, like, deficiencies which happen over a period of time. And
Mhm.
then there are chronic telogen effluvium, that is like a chronic stress that is happening over a period of time that can lead to chronic telogen effluvium. And also there are a number of factors like, hormonal changes and thyroid, endocrinological problems, and the list goes on and on. There are innumerable causes probably for hair loss, out of which there are certain main issues which we'll deal with today.
Okay. And as we often say, hair is like our report card of our health and our mental health, physical health, etc. If there is any deficiency in our body, it will get reflected on our hairs. If we are not well mentally, we are stressed out, it will get reflected on our hair. So, can a person's lifestyle play a role in hair loss, doctor?
Absolutely. So lifestyle again includes your diet, your exercise, and sleep patterns. So the diet, mainly the fat diets like a keto diet, all that, the food fats that we have, low carb diet, suddenly we stop certain foods, all that can lead to a imbalance in the gut microflora. We all know that our intestines are our second brains, right? So
Mhm.
a lot of changes happen with our diet, which lead to a changes in the intestinal bacteria. And many of us don't know that the hair needed vitamins, which are B complex vitamins, basically, including biotin, most of it is synthesized in our own intestine. So if our food is good and the bacteria keep producing the vitamins, we don't have to pop up supplements. So it is so important that the diet, that's where the lifestyle comes, and the exercise habits, because you need to digest your food properly, you need to exercise. And then adequate sleep is important to maintain your stress hormone levels low.
Right.
The three things that is so important for hair as a lifestyle related issue.
Okay. And as you mentioned, people keep on popping vitamin supplements, despite knowing that whether they are actually deficient of those vitamins, like you mentioned, biotin. People will like to go and pop up iron supplements or zinc supplements, or biotin is again very common. Now, how good or a bad practice it is to go buy over-the-counter supplements and start, using it on a regular basis, rather than going and actually finding out whether and what is the actual cause of their hair loss or whatever hair related problem they are going through.
Exactly. It's always better to get yourself evaluated, and after that only we need to treat it. So in case if you are not deficient, why do we need to take the supplements? So
Exactly.
sorry, there is a bit of technical glitch over here. Just give me a minute.
No problem. So by the time our doctor get back and get holds of the technical glitch, today we are going to talk about hair care. We are trying to understand the reasons of hair loss, what's normal, what's not, what's when should we be concerned about our hair loss, etc. And of course, we are right now talking about the importance of nutrient supplements and how good or bad it is when we go and start using over the counter supplements. Yes, doctor.
Yes, it is not recommended to take the supplements on their own, but many of these supplements go on accumulating. So certain supplements put a extra burden on the kidney as well. So it's better you get evaluated yourself, get yourself examined. What is the reason for hair loss? So I told you innumerable number of causes for hair loss, out of which a few we elaborated. But then most of these supplements are not required when you actually get yourself evaluated. So what is required, take only that and do the necessary lifestyle changes. That's what I recommend to my patients. So
Oh,
for example, I just tell you vitamin D supplements, which many of us are taking, but if the overdose happens, that itself can lead to hair loss. So it's better
oh.
to get self evaluated. What is the
Mhm.
deficiency? How much, how long you should take? And what are the other natural ways of replenishing it? We should understand that, and that's how we should go about it.
Exactly. To excess of everything is bad, So it's always good to first go check with the doctor, check with an expert, get your test done, and then go as per the doctor's advice. Now, doctor, as today we are going to talk about hair care. What is the significance of hair care, especially in the modern, time?
Yes, it is so important for us to not to abuse our hair. So we, as
Right.
you told initially, we do a lot of things starting from blow drying, and then we do professional curls and color it, whatnot, a lot of
Yes.
things. So when we do all this, we should be aware of our hair care routine as well. So
Mhm.
regularly, apart from the lifestyle like eating healthy and exercising and the diet, hair care practices are also important. So when it is not important to blow dry, better naturally dry the hair,
Mhm.
and avoid using a hot water for showers. It's better to use lukewarm water, and keep
Mhm.
the shower time quick. If you wash your hair for a long time, if you use a harsh shampoo, and if you use excessive shampoo, that again damages the hair. So then the other thing is conditioning every time when you wash. It is important. The
Okay.
natural hair conditioners are hair oils, which our again grandmoms used to do it, but we have no time for oiling many a time. So at least whenever you find some time, if you don't have a dandruff issue, you can definitely oil the hair. Oil the entire length of the hair. Many people just apply for the center, and they think that it is done. Or there are some people who will not apply at all, and then just wash the hair dry all the time without using a proper conditioner. So if you are not using the oil, remember it's so important to use a good conditioner, and conditioner should be used whenever you wash your hair, and applying a good hair serum, and then avoiding all those with harsh chemicals like hair sprays and all.
Mhm.
Only extremely necessary people can use it. Again, after that, you have to use a very mild shampoo to wash it. Never forget to wash off those hair gels and hair setting sprays before you go to bed. So if you keep that and go to bed, again the hair breakages can be a problem. So all that hair gels and hair sprays which you use to set up the hair, that
Mhm.
needs to be washed off thoroughly with a lukewarm water or maybe cold water. That cold water probably is the best, tap water, and then
Mhm.
use a conditioner. So and then coming to the combing practices, again you
Okay.
have to use a wide toothed comb and do it gently. Start from the ends and tips and do it very gently. And if you have got a curly hair, again you have to part it nicely and do it part by part. So if we are rough to our hair, it tends to have split ends and breakages, and then becomes a frizzy hair. So we
Mhm.
can avoid it by being gentle to our hair. And then, yeah, using a good hair serum also matters. So whenever like you need to use a spray or something, it's better you use a medicated one, so that along with the hair softening, you also give some nourishment to your scalp and keep the scalp healthy.
Right. So we need not to abuse our hair. We need to be very gentle with our hair. Now, I'd like to come to all the points one by one. You said it's important to, wash your hair, not take a long under the shower, and not use very harsh shampoos. And conditioning again is very important. Now, there are people who say that when they go and for a hair wash, they tend to lose a lot of or shed a lot of hair, and that's what is actually restricting them from washing their hair regularly or twice a week or thrice a week, etc. With conditioning, people have the same complaint that whenever I try to condition my hair, I end up losing a lot of or shedding a lot of hair. So I'll try to avoid conditioners. How would you address those issues?
Yes, this is a really good question because many of our patients have this complaint. So
Mhm.
whenever you are using a conditioner or whenever you are washing, you are just losing those telogen hairs which are about to be shed. So the hair grows in anagen phase, it rests in catagen phase and shed off in telogen phase. The telogen hairs are to be shed. So when we wash, the telogen hairs are shed off. If you don't wash also, they'll be shed off, but you don't see them, but you see them all over the houses, pillows everywhere. But when you
Right.
wash, you see a lot of hair at a time falling. But remember, these are hairs that are to be fallen. So it's okay. So if your telogen hairs are falling in the washroom, you can collect them easily and throw them off. So it is a better way. And conditioning, yes, when you put a conditioner, it detangles the hair. So the hair that is sticking onto your sticking and clinging on just there, which comes off. It is also known that there is an immediate telogen release when you apply certain conditioners. And if you should not be using a conditioner on the scalp, actually. It's only for the hair. So the detangling makes the hair appear more in your hand when you condition. It's only the detangling, it's not the shedding from the roots. But yes, it is important to use a good quality conditioner.
And any ingredients to look for that should not be there in our shampoos or conditioners and etc. Any particular chemical etc. which can be very harsh or damaging for our hair.
Yes, of course. See, the sulfates and parabens, many of us know about it. They dry up the hair. And there are certain carcinogenic chemicals which were used earlier, which is removed now. And then the commonest drying up agent is formaldehyde, which should be avoided again, which again can dry up the scalp and irritate the scalp. Some of us are allergic to formaldehyde. So these are the chemicals which we commonly look for. But if you take a shampoo or a conditioner, there are 50 to 100 ingredients in every shampoo or a conditioner. So we cannot actually eliminate a lot of chemicals, but we can actually assess what is suiting our hair, what is not making our hair frizzy and dry. So we can use them. And whatever conditioner you are using, just make sure that you are using something which is lacking all these chemicals that I just mentioned. And also be gentle on your hair.
Right, be gentle on our hair is really important. You also said that oiling can be done as a preconditioner, thing. Now the thing is that in our tradition, as we, in the beginning was saying that the nani or dadi ka nuska is not working anymore, and one of the most important nuska was to apply oil on our heads, not on our length of the hairs, but I'm talking about the scalp, because we have this tradition of applying a lot of oil on our scalp, leave it for hours, sleep with the oil, the scalp, etc. But you said that it's good as a preconditioner thing. Now, for all those who are using, oil on their scalp, or sleeping with the oil scalp, or going out with oiling on their head, etc., what would you like to say there?
Oh, certainly the oil, too much oil definitely doesn't make us feel good. But yeah, as a tradition, if you're using it, if you have no dandruff, if you have no acne issues, then it's okay. But if you have a acne issue, then strictly it is no. And if you have a dandruff issue, or if you have got back acne, body acne, definitely not. So oiling as such, it is enough to oil the hair for 2 hours or 2 to 3 hours before hair wash is good enough for the scalp conditioning benefit. And a light massage makes you feel good. All that is okay, just to relax. Oh, as long as you don't have acne and seborrheic dermatitis. So if you've got an oily scalp, greasy scalp, better you avoid oiling.
Fair enough. And then with the comb and the way they comb their hairs, etc., as you mentioned, that what is the right way of combing. Then there are people who start combing when their hairs are wet. Then there are people who try to rub their head really rigorously with a towel to dry their hairs. Of course, blow drying, etc., there. I mean, now, these days we have blow dryers in our bathroom. So as soon as we are finished showering, we can just start blow drying our hair. So now these things are there, right? We can't actually go away or live without them. So how to use them correctly?
Yes. See, the blow drying again, just to make it little less harsh on our hair, we can keep the temperature low. So we should not keep the temperature very high, because we all know hair is made up of keratin. Keratin is basically a protein. So whenever we heat a protein, it gets denatured. That means the amino acid bondings in the hair, that gets broken. So the hair becomes more dry and brittle. So it's better we keep the temperature low, and we need not blow dry 100%, right? So a reasonable level of drying up is good enough. And then 80% is max, what we say. Little bit moisture is okay, leave it. And we should never comb a wet hair. Immediately after washing, we should not comb the hair. Little moisture is still okay, but just do it gently. When the hair is about 80 to 90% dry, So allow some time for the hair to recover from shower. So then we start combing. So not immediately, and start from the tip, go gently up so that you detangle very gently. And
Okay.
yeah, apart from blow drying, what else we do on a daily basis? I think that is the main thing that most of the people do it, because you're in a hurry to rush to work.
Exactly. So that is one thing that we can start practicing. So we can keep the temperature very low, and we should not comb our hairs when our hairs are wet. And doctor, one more thing, as I also said in the beginning, that nowadays nobody keeps their hair virgin. Either we have some or the other chemical treatments we have done. Either we go for rebounding or keratin treatment or curls, etc., or coloring. Coloring is again very very common now with again all these exposure to the chemicals. How hairs or how what's the effect of all these chemical based treatments, saloon based treatments on our hair?
So the hair dyes, most of the hair dyes contain paraphenyl diamine. Those who are free from paraphenyl chemical. And the other thing is ammonia, and a lot of other chemicals like formaldehyde, which is there in the colors, different ingredients. In fact, there are many ingredients to be listed, out of which many of them make the hair dry. Some of them cause allergic reaction. We are focusing on those which cause dryness of the hair. Okay. So the hair that becomes dry after coloring, the saloon guys give you a different shampoo and conditioner and ask you to do it, routinely. But then many people follow it for short time and then forget about it. So that again leads to dryness of hair. Again, not just that, a good shampoo and conditioner we have to choose for a colored hair, which is very, very important. And after coloring, the maintenance is equally important. We need to use a decent hair serum as well whenever we are combing. So because if we don't want to use a oil which makes our hair sticky and all these acne breakouts and things like that, better to use a good hair serum so that can give that softness required for the hair.
Okay, and we'll also take some of our viewers' questions. Many of our viewers, like Ankit Chaurasia, and we have Shravan Sahu, they have the same question: how many times a week should we wash our hair?
Again, that depends on how your scalp is. If your scalp is oily, and again how your lifestyle is. So if you're a person who goes out, you are on a marketing side and you roam around the city, you are exposed to pollution, then it's fine to wash every day. If
Mhm.
you're a person office based and work from home person, then twice a week washing is good enough. So depends on the scalp actually. And if you have a dandruff, we say it's okay to wash every day, but use a gentle shampoo and an anti-dandruff shampoo which contains medications at least twice a week.
Okay. Now, because again, dandruff is very common, and people often, will come under or get trapped in the marketing gimmick and go for all those cosmetic products that claim to be anti-dandruff. Now, what's your advice to them? Because dandruff at times becomes really, really a big issue.
Yes. So dandruff, again, it's not just a scalp issue. Many a times a lifestyle issue. So we have to first look into their lifestyle, their hormones. Many a times hormonal changes lead to dandruff. So get yourself examined. And it is not just seborrheic dermatitis. Sometimes it can be scalp psoriasis as well. People get
Mhm.
confused it with dandruff and they continue to treat the anti-dandruff shampoos. So which may not be actually working. So we'll have to first see a dermatologist and get yourself evaluated.
Exactly.
Sorry for the disturbance.
No,
Yeah.
it's absolutely okay. And I think it's very important to understand that in case we have any hair related issue, which is not, getting fixed soon, then we should go and consult a dermatologist. We should go and consult an expert so that we can, start the treatment, or at least we can diagnose why it's happening. Many times it has been seen that when you go and check for the reasons of hair loss, etc., you end up understanding understanding that you are actually going through a medical condition. Maybe your thyroid is, fluctuating, or you have some hormonal issues, as you just mentioned, etc. So, so thus it becomes even more important to go and consult a dermatologist if your hair problem is not fixing uh, in a
Yeah,
certain time. Uh,
exactly.
Again, many viewers are asking similar questions, and I'd like to take one of them. Vaishali Dubey is asking, what are the home remedies for hair in winter? I would like to add to that, do these home remedies actually work on our hair?
Yeah, can you please tell me again, home remedies for hair loss or home
In
remedies
For hair in winter.
in winter?
Mhm.
Okay, so home remedies in winter for those who have a dry hair, yes, like the oiling, and a lot of people use menthia, hibiscus,
Mhm.
bringraj. All
Mhm.
these are actually good conditioners. So
Ah,
they
okay.
act in conditioning your scalp. Some of them, like Centella asiatica, that actually known to improve the blood circulation.
Mhm.
But again, yeah, if it is like, if you are evaluated and you don't have a medical condition, then these are okay.
Right.
And it gives you that feel good factor as well. So
Mhm.
home remedies are not always bad, but you have to be careful and understand your scalp first. So when you meet a dermatologist, when you do your hair scan, and when you get yourself examined how your scalp is, you understand that, and then
Right.
ask the doctor whether you can go for these things, whatever your home remedies are. You just ask that if that is not harming your hair, we will never stop it. So, yeah, can be done
Exactly.
with caution.
So even if you're going for home remedies, it's always advisable, always good to go and check with your dermatologist to understand why it's happening, whatever issues are happening, why it's happening. Even with dandruff, because dandruffs are of many types. They can be maybe you are taking them as dandruff and they are something else. So it's always good to consult a doctor before doing anything on your own. So please go and consult your dermatologist before going for any home remedies, etc. On routine, definitely, as doctor is saying, you can use oil, you can use hibiscus, other things as conditioner. But in case you're trying to deal with an issue, please go and consult your doctor first. I'll pick a few more questions. Okay, Ayushi Vishwas is asking which vitamin is best for hair. Now, in this, I would also like to add that, because as we were talking in initially, that people like to go over the counter and buy supplements and start using them. Can we replace that with our thali or our food habits, etc.? So how to include all the vitamins, minerals, micronutrients, macronutrients to have really good quality of hair?
Okay, I'll answer the first part first. That is the which vitamin is important. A lot of
Mhm.
people take these gummies and all. This is not
Mhm.
actually right. There is no single vitamin which is required for the hair. Again,
Right,
biotin only vitamin that is required. It's a myth. So we
right.
require a holistic approach. We require a lot
Mhm.
of macro and micronutrients for hair. So we require iron, zinc, calcium, along with other B complex vitamins. Even vitamin D receptors are there on the hair. So a holistic approach should be there. We require, now coming to the second part, that Indian, that typical thali, which contains all the carbs, proteins, vitamins, everything, including the probiotic, everything is there in our diet. So there is nothing to replace a good diet. So I would say, eat well and chew less supplements.
That was really, very, very wise of you to say that. Eat a very balanced diet and have very less dependency on gummies. Now, the thing is that nowadays, again, many times types of diets, many types of fasting, etc., is there, and people are going for them. But after going through the diets or the fasting, etc., they all of most of them complain of hair loss or frizzy or dry hairs. Now, how to tackle with that issue?
So when the fasting, intermittent fasting, and this kind of a thing, or a diet which is being followed, it's
Mhm.
better to be in consultation with dietitian and dermatologist together, so that they can plan. In case if you are putting on a low carb, okay, you need a probiotic supplement because your gut microflora should not suffer. So, or they can just give you one bowl of curds just to replace that deficiency of microflora that keeps happening, or a little bit of carbohydrates that you are used to eating throughout your lives. For example, if you are a rice eater throughout your life, if you stop rice suddenly, the bacteria again go panic, and they stop working, and they become less. So because of that, you suffer deficiency. So include a little bit of that in your diet. So no dietitian will say totally you have to fast. Or if there is an intermittent fasting that you are following, again, that can be supplemented with proper nutrition supplements as per your requirement.
Right. So please go and consult an expert before going or starting following anything. Please go and consult a doctor. That's good for your health. Shreya Verma is asking again a very common general question: how to get rid of split ends?
Easy, chop it off.
And how bad these split ends are, and I mean, what is the disadvantage of having split ends other than their look?
See, when the hair end becomes like this, the split, so there is an easy way it gives away like this, and it can extend. So a long distance of the hair can chip off from your hair. So the hair goes on becoming thin, and the volume goes on reducing. It becomes more frizzy. So it's always better to trim that split end before it leads to further split ends and further breakages. So
So regular chopping off or trimming is what
is
you're advising.
recommended. Yes, regular trimming is good. But if you want to grow long hair and you want to leave the hair open, the hair is definitely prone for environmental damages. How these split ends happen is because of the air, wind, when we leave the hair open. So
Right.
if you want to grow the hair, I feel braiding is the only way. So most of us grew the hair long when we were in schools. Why was that? Because the braiding was compulsory. So
Right.
the hair wouldn't split, and the oiling and conditioning used to happen regularly. So
Right.
after we grew up, we left all that. And now if we want to grow hair long, it is not easy. So split ends need to be taken care regularly.
So our age-old tradition of braiding our hairs can actually save us from split
If you
ends.
want to
And
grow it long, yes.
yeah, otherwise you can keep on trimming it on a regular basis. Now many people are also asking about thinning of hair. So what's thinning? I mean, one is that we are shedding a lot of hair. That is one issue, and another issue is thinning of hair. Why it happens?
So when you lose your normal number of hair, but you are not able to get it back normally, so the thickness goes on reducing. We call it miniaturization. So many a times it is a hereditary male pattern or a female pattern hair loss. Sometimes it happens due to hormonal changes and also due to stress and things like that. So this is called patterned hair loss, or also it is genetic hair loss. So as it happens, the hair goes on getting replaced by small thin hairs. So this small thin hair doesn't give any volume to the hair. At the same time, it makes the scalp more visible. So gradually, even the small thin hair disappears. So we call it scalp fibrosis. So over a period of time, what happens? The scalp becomes a smooth surface, which you can, the shine appears. So
Right.
it's always better to treat early. If you have a parent who or grandparent who is bald and you see thinning of the hair, because there is a lot of medications that are available, you can always maintain your hair as long as you love your hair. Just I say maintain. So maintenance would be required for those who have a genetic hair loss, and they don't have to feel bad because there are n number of medications now available.
Exactly. So if you have a family history of baldness, etc., then please go and consult a dermatologist early so that they can do something to prevent early baldness, etc. And another very common problem these days with hair is graying of hair. Many of our viewers are asking about how to get rid of these gray hairs or the early graying of hairs, how to prevent them.
Yes, premature graying or early graying has become a very common problem, especially metro cities. A lot of reasons. One of them is the stress that the kids go through. So when we call it early is when it is less than 25 years of age, you start seeing gray hairs. It is called early graying. The commonest reason being anemia, that is the lack of hemoglobin or the iron level being low. So, and then the second is thyroid problem, vitamin B12 deficiency. These are the common causes. But apart from genetically also people can get gray hairs early, at an early age. So this gray hair treatment is quite prolonged treatment, but then we have to first check them for all these reasons that I mentioned. After evaluating properly, whatever is the deficiency, that we supplement. Along with that, we do have some hormonal supplements or peptide supplements which are given to the scalp, and that starts generally reversing the gray hair. So earlier days we were saying that gray hair has no cure, but nowadays there are medicines which are actually helping the patients.
Okay, so Shubham Maran, you have your answer. There is, treatment available. Go and consult your dermatologist if you are experiencing premature graying of hair. We also have viewers who are asking, like Anamika Sharma is asking, does using a hair dryer or straightener damages hair?
Of course it does. We all discussed this. It is just the heating of the hair, and heat definitely damages the hair. But then, yeah, you need to condition your hair properly and make your hair little stronger before you do any of these treatments, and avoid it as far as possible. Whenever it is inevitable, just take a little extra caution.
Right. And especially during monsoons and winter, people find it very hard to take care of their hair. They look very dull, they look very, the luster is gone, etc. So, what to do, especially during monsoon or winters?
So monsoon, when you get wet or drenched in rain, when you come home, just take a shower. Wash off all that polluted hair that has fallen in on your scalp, especially in metro cities. So first wash off that hair and towel dry gently. And then you can use a conditioner also while washing. And after washing also, you can use a good hair serum that can keep the hair luster and the hair smoothness intact. And yes, in winters, because those people with dandruff, it flares up. So you tend to use those anti-dandruff shampoos, which are quite harsh on the scalp. Again, here conditioners come for your rescue, and leave-on conditioners are available. Leave-on hair serums are also available, which can be used judiciously to maintain the hair smoothness and shine. But washing regularly, remember, is very important, whether it is monsoon or winter.
Okay, so keeping our scalp clean is very important. Another problem that people face, especially during monsoon, is fungal infection. Please shed some light over it.
Fungal infections are common in children, but again, seborrheic dermatitis is also caused by a fungus called Malassezia. That again grows in damp hair, which is not washed properly. Again, the scalp which is oily, the people who have got sleepless nights, those who have got a hormonal imbalance, seborrheic dermatitis, or the fungal infection of the scalp. Seborrheic dermatitis, basically the fungus is a skin-friendly fungus, which is there in everybody's scalp. But those who have got a good condition which favors the growth of the yeast, it grows more. So the numbers have to be controlled by using the antifungal shampoos. Again, tinea capitis, or the proper fungal infection of the scalp, is extremely rare in adults, but it can happen when the hair shaving or trimming done in a salon which is contaminated with the fungus, the blades or razors are contaminated, or if the person has a fungal infection elsewhere and that is spreading to the scalp, it is possible. But adult scalp is quite resistant to fungus. If that happens, it needs to be treated properly with antifungals.
Okay. We have Gayatri Sinha who's asking, my hairs are starting to thin. Should I go for hair transplant?
Yes, hair transplant is a wonderful treatment, but it is not for everybody. Those who have a patterned hair loss, which is in grade 2 and grade 3 and above. So for them, hair transplant comes to a rescue. For men, definitely, hair transplant is a surgical method which can we used to as a long term treatment also, because the front lock is preserved, their look is preserved. So
Mhm.
the front profile changes, it gives them a lot of confidence, and done with a proper trained surgeon, it gives excellent results. So hair transplant, yes, if the but you have to go with a trained dermatologist or a plastic surgeon or a dermatosurgeon, who tricho specialist or a hair specialist only you have to do, not with anybody who else who is offering you a cheaper hair transplant surgery. So remember, it's a medical procedure to be done with a qualified specialist. So hair
Exactly.
transplant is only after evaluating the patient, the doctor only will suggest you if you need it.
Okay. And Raja Roy is again asking a very important question that many people, ask or use as an excuse. He's asking, do helmets cause hair loss?
This is a very common myth, and we all know it doesn't cause hair loss. Helmet is very important to protect your scalp, not just scalp, to protect your head. So when you are in two-wheeler, please wear your helmet. It is so important, and make sure that you keep your helmet clean. So do not leave it in the open streets. A lot of dust enters into that, and if it is wet, please don't wear it with the wet condition, and wash it regularly and keep it clean. So that's important.
So keep it clean is the bottom line, whether it's your scalp or the things that you are using on your scalp as an accessory or helmet or your comb, etc. Keep it clean. It's really important. Now, doctor, before we sum up the whole session, anything that we missed on anything that you would like to elaborate before we sum up the session?
I think we covered most of the aspects of modern day hair care. You were a wonderful anchor, Sanyukta.
Thank
So you
you.
covered most of the things, common concerns that our patients have. So I think that's it. If we have addressed all the queries, it is indeed a crowning glory. So we all need to maintain the hair well and give the due respect to the hair, and the necessary scientific method of treatment you have to follow.
Right. And in case there is an issue, please don't waste your time in self medication or over the counter medication. Go and consult the right person, a dermatologist, a qualified dermatologist. And that's really important. Thank you so very much, Dr. Shilpa Bhat. It was wonderful talking to you. Thank you for your valuable guidance and advice on how to keep our hair healthy, especially in the current scenario where, apart from the environmental and the genetic factors, the increasing levels of pollution, stress, they are all taking a toll on our hair health. So thank you for your guidance, and I'm sure it will help our viewers, and the viewers will use it to have good, luxurious, lustrous lock or hair. Thank you so very much once again.
My pleasure. Thank you. I hope it will be useful for the audience. And thank you. You've been a wonderful host. Thank you so much.
Thank you.
Thanks to Ipka for this session. Thank you
And
so much.
viewers who want to get personal consultation from Dr. Shilpa Bhat, they can visit Subodha Skin and Cosmetic Clinic, which was established in the year 2012. Subodha Skin and Cosmetic Clinic caters into the latest advancements in aesthetic medicines also. A big thank you to all our viewers for watching the show, and for more information on how to get all your hair issues resolved, do like and subscribe to our YouTube channel, Hair All Issues Resolved. Thank you. Good day. Goodbye.
Thank you.